en ni Amref Health Africa koriwore kod sirikand kaunti ma Migori osechako chenro mar timo ndikruok manoeri biometric registration ne ji maromo 24,000 e kaunti ma Migori e phase mokwongo mar universal healthcare. Ji maromo 24,000 e kaunti ma Migori kono osechak timnegi ndikruok kod okumba mar NHIF e buo Universal Healthcare Program mabende ichako e jumanieri e moko kuom ji 120,000 mabende oseyieri. Okoloso e kinde mabende ni yawayanga chenro makamano jatenda Amref Health Africa Laktar Catherine Kanari owacho ni ji mamoko mathoth ibiro timnegi ndikruok makamano akaito ichiwonegi cards mag NHIF e phase mar 2 mar chenro makamano.
The government has done a great job in trying to alleviate the healthcare financing by providing this coverage and NHIF registration for its citizenry. And so we're very grateful to see it kicking off in Migori, and we know a lot of people will benefit from it. Actually, when we look at the data as of today, the CHVs and the people of Migori have done a very great job. They've been able to map at least 160,000 households as at today, which is very impressive. I think we've rolled this out in 6 other counties, but Migori has gone way ahead and overperformed, and we appreciate this from the county, and we'll continue working with the county to ensure that everybody who is then an indigent will be able to benefit from this scheme eventually. We know when we talk about universal health coverage, we're talking about access to quality medical services. As has been mentioned, this is in the pipeline. As I've heard, the dispensaries are in place, the facilities are being well equipped, and also we are talking about financing of this health access. So when you look at the NHIF aspect, it is what then will alleviate the out-of-pocket expenditure for especially the poor people and the citizenry of Migori. So thank you for the partnership that we had with Amref Health Africa, specifically Amref Health Innovations. We are able to then use one of our tools to collect this data, and this data is very rich. Not only did it collect the social economic mapping, we're also able to collect data that has indicators that are very crucial for health. We're looking at the non-communicable diseases, the water and sanitation and health. We're looking at reproductive health and many other facets of data that we're able to get. And we know the county is going to use this data very well for its planning, for its policies, and even for budgeting and how they will then apportion the county's resources to the citizenry.
Bao tayari tumewa-identify kama watu ambao hawajiwezi kujilipia huduma za matibabu. Kwa hivyo kama county pamoja na partners kama Amref, NHIF and national government, we came together and identified 24,000 residents of Migori County who will be benefiting from free medical services by way of being paid for by NHIF. It's a national government program targeting all counties. Migori, we have 24,000 people. So today, we have come in to now register them so that whenever they go for treatment in the hospital facilities, they are able to access the services without any issue. We emphasize and we focus so much on primary health care. That's why Migori County is one of the few counties who have CHIWs. The CHIWs are community health care workers who are working with the communities to sensitize them on prevention rather than cure. So we have brought in the aspect of now care to people who are unable to pay for the health care.